about the issue of high blood pressure. My first question, Dr. Chauhan, is where should I get alarmed? What is the first symptom?
Yeah, this is really a very interesting question, because most people, they have high blood pressure and they don't know about it.
Right.
Sometimes they
just
neglect the symptoms of that.
Yeah.
So that's why it's also called a silent killer. Sometimes, because the symptoms, you should be very careful. If you have like heaviness in your eyes, you have headache, you feel blurry in your eyes, or sometimes you're feeling very hot in your body. You are not able to sleep properly. When you go to sleep, you're even sometimes you can feel like some pulsation either in the head or in your heart. So that indicates that something is wrong. You should always try to go for a checkup. Check the blood pressure. These days you can find blood checking machines which you can keep at home also. And if you have any of such symptoms, this is the first thing you should do: check your blood pressure.
Right.
Because if you don't do it at proper time, the blood pressure can damage a lot of things in your body. It can damage your kidney. Right. It can damage the heart. It can damage it can have some rupture in the brain. Some arteries can burst and you can have paralysis. It's very, very dangerous. So you have to always remember, watch your blood pressure. Keep your blood pressure under normal limits, and which is like 120 by 80. There is when our heart beats, so we measure when the heart pumps. This is called the upper limit, and when the blood comes back to the heart, it's the lower limit.
So I will ask you the other way around.
Yeah.
What is the easiest way to drive yourself into the high blood pressure? What kind of lifestyle? What kind of food?
You mean how do we get it?
Yes. How?
Yeah, smoking, alcohol, eating a lot of fried foods. Obesity is one reason also. And then mental stress, very big factor. A lot of stress when you have work-related stress or family stress or financial stress. And sometimes it is also caused due to the climate, especially in the winter seasons. The blood pressure tends to go up because due to the cold climate, the capillaries, they become constricted and the pressure on the arteries is more. So this is primarily the cause. And then people who are also having a lot of indigestion, for example, they have hyperacidity. According to Ayurveda, we can see a lot of people who have hyperacidity or who have wind formation in the stomach. Or in Ayurveda, we also have a very interesting word which is called ama. Ama is a toxic material which is produced from undigested food. So when we have indigestion and food is not properly digested, ama is produced, and this ama can go into the blood capillaries and stick to the walls and then clog, which sometimes we can compare it with triglycerides and cholesterol and all that stuff.
Right.
So this is how blood pressure is caused. Sometimes it's also caused as a secondary disease as a result of kidney disease, for example, or if you have diabetes, you can have blood pressure. So these are various causes. So one should be very careful.
The subject of coffee and high blood pressure.
Yes.
It's not very clear.
Yeah.
I know that coffee, pumps up your...
Yeah, caffeine, alcohol, nicotine, all these things, they actually increase your blood pressure.
But sometimes while, even if you're having some disease, then your body kind of stimulates your brain to thinking that this is actually good for me. It's nothing bad. And this happens with coffee because coffee is like this, it's just a coffee.
Well, in Ayurveda, we don't say it brain, we call it mind. And mind does not necessarily really understands the physical system very well. Brain is different, brain has some automatic responses, to the body. When body is in some kind of crisis, then brain will order. But when people desire coffee, it's not the brain, it's the mind, we're going one step deeper,
they rationalize
and
very
that's the
well
mental desire, and that's what you want to drink. And it may not necessarily match with your physical things, maybe physically it will be more dangerous for you. So we will talk about mind in some of our episodes and try to understand.
It seems like everywhere there is a mind cause, mind stress, which is a root cause of...
And this is very interesting that a lot of people today are suffering in the mind and they don't know what is mind and where is mind and how does it work.
So what can we else know about high blood pressure?
Well, I think the basic thing is that if you have high blood pressure or if you have any symptoms that I just mentioned, very important simple things. You must exercise every day. You know, it's very, very, very.
But how to exercise?
You go for a walk. You know, a little bit jogging, not like strong exercises. Not strong exercises. You can do yoga postures. You can do some kind of breathing exercises. These are very, very effective. Anybody out there who is having high blood pressure, start walking about 30 minutes every day or do some stretching exercises, and within a month you'll see interesting results. I have seen with so many of my patients. Then second thing, watch your diet. You know, don't overeat, don't eat too much, you know, heavy food, fried things which can create ama in your body. Try to eat something simple, light, which is easily digestible. And the third thing, very important, is the mind. You know, you have to keep your mind relaxed. That's where there's a lot of clinical studies have been done where they have found out meditation can lower down your blood pressure, meditation can lower down your heart rate, and meditation can help you also, you know, clean up a lot of the toxins from your body. So meditation means just relaxing your mind, you know, deep breathing or lying down in a posture where you just breathe and just observe your breath. Simple things.
I start to like it already. I'm already curious how it's going to be the talks about mind, which seems to be the cause of everything.
And I would like to mention that most people, they just take to taking some pills, which is not very good because it's not really working on the root cause.
And we need to work on it.
You're just suppressing the pressure, you know, maintaining it, but the cause is still there. Right. And this is damaging many other things in the body.
And about that cause, we'll talk on a separate way. Thank you and keep in touch. See you on the next episode.